Robin Castleman, and I'm here today with Dr. Matt from the Regenerative Center. And Dr. Matt, it still just blows my mind that some people don't totally grasp what the Regenerative Center is all about. Will you fill us in again?
Yeah, it sometimes shocks me a bit too, but we've been there a while. But regeneration is all about the opposite of degeneration. So many people, well, eventually all people, develop some type of condition in a joint or an organ system where that part of the body is just not getting better, and they're having all kinds of symptoms. And in our traditional world, we go to the doctor and we get medications and things to mitigate the symptoms. But with regenerative therapies, and this is still, I wouldn't call it new, but it's young, where it's a field of finding different kinds of healthy cells and apply them into that organ system, be it a joint or a systemic issue, where the body can actually take those cells and repair and get back in balance again so that they can live a successful life and thriving.
And so we're not just throwing like Tylenol or ibuprofen at something constantly, which is not good for our organs either.
That's correct. We're not trying to deal with just the symptoms itself, but our goal would be that the lab work changes, things change that prove that there's an actually scientific evidence here that things are better and the patient is feeling better and can get back to their life.
Well, give me some examples of some things that you could treat.
Yeah, it's probably our most common, I would have to say, is orthopedics. We see thousands of patients with spinal conditions where they're in a degenerative disc disease or some kind of a problem, and they're just struggling and suffering, and they want it to get better, so we build protocols for that. Lots of patients. Today we have people in our office from about 7 different states, so they'll move up here. 30, 40 families a week will move up here, sometimes stay several weeks. Any orthopedic condition, from shoulders to joints, any of them. A lot of neurological stuff. We see a lot of things like Parkinson's disease. We just had a guy from New York last week, and he came in. It was really cool to see him that he wasn't even able to hold a fork, and now he can actually, he was showing us how he feeds himself. He's walking again, and just to see things like, so ortho, neuro, I would say autoimmune is a really big one. Now we see a lot of autoimmune conditions coming in, and people are really sick, and we see them get a lot better. And lungs probably is the fourth one that I would say.
Gotcha. Okay, so maybe some of that sounds like some COVID symptoms, leftover stuff coming around that maybe we're treating.
Yeah, took a couple of calls this morning, a post-COVID call from Maryland this morning, that she was just really sick and looking for some kind of solution. So we'll build a protocol for her. She'll send her labs in, or I'll send some lab work to get it back and just see where her baseline is and try to build a protocol for her.
Gotcha, because we're all different. So even though my knee may hurt and your knee may hurt, we may have different things that are causing it, right? That's
right. You're kind of tiny and small, but some people are taller like me. So you have to build a specific protocol, not just with cells, but sometimes it takes the type of brace, a little bit of physical therapy, but it's just building the right protocol for that person and just watching them be successful.
Okay, and this is my favorite part. We don't have to have a doctor referral to come see you. We can just call and make an appointment, right?
We actually, any patient can call us at any time. We can, we have medical doctors and physicians there that can help to not have to worry about the referral, and we can just basically sometimes take a free call and just sit down and look at your labs or your MRI or whatever, and just help you before you ever show up at the office.
I love it, and you're so easy to talk to, so I will highly suggest anybody coming and getting, if you've got a pain, get it sorted out.
Sure, we love people. We just love people.
Well, thank you so much for being with me. I appreciate it. Fun.